again a little bit later. But in terms of therapy, again, coaching is a lot like behavioral therapy, cognitive therapy, and then social learning theory. So I'm kind of going to leave that for now, but just so you know that there are types of therapies that coaching is closer to than others. The big difference is that coaches do not explore serious emotional, cognitive, or behavioral problems of clinical intensity, such as depression, anxiety, or substance abuse. Now, you heard me say earlier that coaching can be very effective for clients with depression or anxiety. So we're not saying that if you have those things, coaching doesn't work for you. What we're saying is the whole, in my case, it would be a 50-minute session. The whole 50-minute session, it can't be devoted to those serious emotional problems. So if we have a client come in who is experiencing a lot of those, then often what we'll advise is they have a therapist separately and a coach. Because in coaching, then we can focus on the practical strategies, the behaviors, the goals, things like that. And then they can kind of have the time to explore that other stuff there. If it's someone who, say, is mostly suffering from the executive functioning type stuff, but as a result is experiencing just some low self-esteem maybe, which often is the case, then we can usually work it in. So it just kind of depends on the degree of, again, the word clinical intensity of what's going on, whether or not we can address it there in the room or if they need a separate therapist. Okay, so here we have just some more kind of coaching versus counseling. First of all, coaching is goal-oriented. Counseling is process-oriented. And then I put "and goal" in parentheses there because, as I mentioned, kind of cognitive behavioral therapy, which you've probably heard of, can kind of closely mirror that because they'll set goals, things like that. Whereas psychodynamic therapy is going to be all process, all analyzing feelings and behaviors. Coaching mainly focuses on managing changes, personal development, future achievements, and better communication with the environment. Whereas counseling is more about healing emotional stress, and it tends to look at the past, things that have gone on, processing feelings, things like that. Coaching aims at improved performance via behavioral changes, whereas counseling attempts to understand why the client is having difficulty. So in coaching, we like to say we're dealing with the who, what, when, and where, and in therapy, it's the why. Coaching, oh, not quite done. All right, coaching is about creating more choices and possibilities, more options, more strategies, more tools, whereas counseling is aiming at closure. And this one is important too, especially again, kind of for the younger population, but then again, there's some people of all ages that kind of have this feeling. One can admit seeing a coach without risking negative reactions from friends, whereas seeing a counselor and undergoing therapy can be perceived as a weakness. Unfortunately, there's still kind of a stigma that goes along with going to therapy. And so it's a lot easier, again, with the teenagers, if you say, we're going to see a coach, not a therapist, it's a lot easier to get them there. And, it doesn't make them feel like they're, messed up or sick or different or anything like that. Okay. So why coaching is a good option for individuals with ADHD? First of all, they're smart. Russell Barkley, who's one of the big names in ADHD, long ago did a study, and there's been countless follow-ups to this, that most students with ADHD are of average to above average intelligence. So they can get it. It's really not about anything to do with IQ or anything like that. It's just that their brains work differently. So that kind of leads me to the next one, that their cognitive abilities are different than what we're doing in schools. So if you think about it, we're telling a student with ADHD and in the workplace, to organize their stuff, manage their time, not procrastinate, get their work done. Every single thing that's listed under that diagnosis, that's what we're stressing in schools. So, it's like, what do you expect? And then what happens is, when they don't do well, they say, well, I must be stupid because I don't get it. So what we're doing is we're taking their strengths and we're kind of creating new pathways for them, new tools, so that they can succeed in the school setting. Or again, the work setting, if it's an adult. Students with ADHD learn well when they're highly interested, and they show improved performance when tasks are made salient, novel, or interesting. So again, this is what we're trying to do in coaching. We're trying to make it interesting for them. We're trying to take what they're good at, stress that, and we try to keep it interesting, different, kind of changing all the time to keep them motivated. So as I mentioned at the beginning, there's kind of no standard approach to coaching, and we're gonna give you kind of two different examples of what that can mean. But I found this quote, and I think it's a good kind of overall emphasis of what any good coaching strategy should entail. ADHD coaching puts the student's needs and interests at the center, fitting the program to the client rather than fitting the client to the system, extending to all aspects of the ADHD or other person, individual's life.